am going to talk to you not about alternative medicine. Can everyone hear? Is this all right? Mike, good? Not about alternative medicine. I'm going to talk to you about health. Health and health for the next generation. And I have a privilege here, which is that I'm going to be talking to everybody about something that will and has directly affected you and will directly affect you for the rest of your lives, your health. Has anyone ever been sick? Has anyone never been sick? Okay. Being sick is terrible. Can we all agree with that? Right? It depends if you have the flu, if you have a cold. It can be minorly debilitating. It can be annoying. It can be any number of things to a chronic or acute disease which can absolutely knock you off of your game. It can be horrible for you. It can be horrible for the people around you. It can be an absolute tragic situation, right? I think we've all, I hope we haven't, but perhaps we've all known somebody who's also been very ill. It's not good for anybody. It hurts our bodies, it hurts our minds, it hurts our spirits, it takes us down. So I want to look at health, and I want to look at health from a different perspective than I think we all currently do. So I'm going to ask you all just to think, what is health? Just for a second. What do you think about health? Okay? And I don't have a PowerPoint, so I'm going to be using paper, and I'm going to do that. All right. I'm going to come back at the end and see if anything I've said has changed the way you think about health at all. But do you all have some idea? Good. All right. So I want to talk about past models of health and past ways that we've looked at health. If we go way, way, way back, health was really about the avoidance of trauma and the provision of what we needed to accomplish basic human life. We needed shelter, we didn't want disease, we needed nutrition, and we wanted to avoid all environmental factors that were around. That's what it was to be happy, right? If you're cold, if you don't have what you need, you're unhappy, you're miserable, you're dying, and you don't have everything. It's thousands of years ago. I know we're not there anymore. So I'm an acupuncturist, which Lauren didn't say, and I do Classical Five Element Acupuncture. And when I was studying for my national boards, we had to learn all the commonly used points, pass some exams, and I'm looking through all the points. There's one I'm not familiar with, and it says after it says pig bite. And I'm going, what the hell is pig bite? Well, what it is that from the ancient model, one of the major problems and one of the major traumas and one of the major things that the Chinese were concerned about thousands of years ago was pig bite. And you needed to know how to treat it. Now, if I told any of you that you had to worry about pig bite, you'd probably think, what's going on, this isn't it. But that was something that was so prevalent years ago that there was actually an acupuncture point that I had to learn now that has something to do with treating pig bite. So that's a little bit of the past, okay? Now, almost all of that was defined by our survival and in many ways our physical well-being. And I imagine most of you still think about health from the standpoint of physical well-being. When you imagine somebody who was ill, physically ill. Most of you, if not all of you. When you imagined when you were sick, physically sick. Okay? So the health mindset in healthcare right now, as it exists in the West and pretty much throughout the world, is almost exclusively pointed at physical needs, basic functions, and we've all come to believe that physical well-being and health are in fact one and the same thing, largely. Does that sound revolutionary to anybody? A little bit? That physical well-being and health, because I have to say, if that's not what you think, great, I love that. But I'd say that's what I've encountered the most. So how do we respond to that? We've responded to that in a wonderful way. We've dedicated lots of time, lots of energy, lots of resources to addressing the symptoms that get in our way, to curing disease, to fixing problems, to mending legs, to putting everything together, and when something's broken, we put it back together. And I am all in favor of that. I think it's absolutely fantastic. If I get into a car crash and I'm bleeding, I want somebody to sew me up, take me into trauma, take care of it, do that right away. It's wonderful, and we're very good at it. So the other thing we've done is we spent a lot of time learning about how to test our physicality. We have MRIs, PET scans, CAT scans, blood levels, everything else, and I want to reference what Roger had to say. When didn't know he was going to speak about the birth, and I didn't know he was going to speak about everybody looking at the machines and not the baby, but there is something, I didn't prepare the actual reference to just go with me on this, but about 4 years ago I read an article, and I'll get the site later, which compared healthcare diagnosis in the early 1900s to healthcare diagnosis in the early 2000s. And in the early 1900s, there were no machines. And in the early 2000s, there's a great preponderance of dependency on machines. Diagnosis, accuracy of diagnosis in the 1900s was 8% higher in terms of its accuracy than it is now in terms of the machines. The doctors then looked and saw that the baby was coming out, smelled the person, touched the person, did things, and knew what was going on. Now we rely on machines, and it may or may not be accurate. Now, I'm not going to put down the machines. They catch things that are unbelievable. Some patients that I have, I'm working with them. There's no way that I necessarily would catch something as advanced as a machine could. But it's interesting to know that our medical model is based on machine diagnosis, curing things, treating symptoms, and dealing with people in that way. That's how most of our healthcare is focused. Now, since it's TED, and since Roger mentioned Kurzweil, I have to also mention Kurzweil, and this is where I'm going to start to transition to the next generation. Kurzweil would have us believe, and I'm going to quote, before 2050, medical advances will allow people to radically extend their lifespans while preserving the quality of life through the use of nanobots. Now, I don't want to get into the philosophic implications of this except for one thing. The next generation is, if he's right, and if you even follow the trend of medical development, more and more likely to be less and less concerned with physical conditions and health. Kurzweil says we'll get rid of disease. We've had such advances. Do you guys know the last epidemic in the United States was in 1952? We haven't had an epidemic according to the World Health Organization. We've cured thousands of diseases. We have a lot more to go. Don't get me wrong. I want everyone to keep working. But if he's right, and if the trajectory is correct, as we go on, we have to be less and less concerned with our physicality because we can fix anything that goes wrong, which is an interesting thing to me, at least. Okay. So I want to take that notion. I want to look a little bit at social development relative to health and our development relative to how we view health. If you're concerned about pigs, you're worried about keeping the pigs away. If you're concerned about food, you're worried about getting food. But if you have shelter, food, heat, you're safe from pig bite, you're safe from everything else, you have what you need, all of a sudden we can start to think about other things. We can start to think about mental health. Okay? Jung, Freud. We can start to think about sexual health. Kinsey. We can start to think about spiritual health, which is really starting now. The examples I have are Deepak Chopra, Gangaji, the Dalai Lama. I also put the Beatles in there, which we may get back to. I hope we do. So as we become more secure in our basic provisions, we become more able to think of health beyond our physicality and our immediate need to take care of ourselves on a fundamental level. And we're doing it, mostly. And I'm going to get to that. Okay, so the questions turn from, are we in danger, to how can we be happy? Can you guys see that shift? And it's happened and it's happening. And part of what I'm going to get to is that the next generation, a lot of that shift has already happened. But the models and the way people think is so far behind that shift, which has already happened, that we have a lot of catching up to do. Sounds a little Kurzweilian, but I'm going to go with it anyway. All right, so our approach to health. Progress. We address trauma. We address symptoms. We cure disease. We lower high blood pressure. We put in stents. We can take care of most of the things, and certainly almost everything that's an external factor. We can deal with toxins that come in and we can respond to them. We can identify toxins and we can legislate against them. We can change our environments. We can do all kinds of things, and most things that are external, we're good at. But if you ask anybody what causes the things, if it's not an external toxin, if you ask a doctor, okay, you say, I have this, why do I have it? They almost, not exclusively, but most of the responses, we aren't quite sure, but we're researching it. There are a lot of research institutes that are looking into causes, but most of the money and most of the time is spent on cure. So if you ask what causes things, we aren't really sure. We just know that things happen, which is curious to me. All right. Now, we address physical health that way, but we also tend to, and I'm going to shift a little bit, address mental health the same way with the same paradigm. Here's a symptom, and I'm not trying to demean mental health at all. Mental health is very serious and a very big deal to me. But you have a symptom of mental health, you prescribe for it, or you try and treat the symptom. You have a problem with somebody who is in some way mentally ill, and you try and fix it. And again, No sense of where did that come from, no sense of what caused it, but the same model of here it is, it's a problem, let's fix it. All right, now, spiritual health. I know I mentioned that as well, and I'm going to get more into that later, but as far as I can see, and I am an alternative healthcare practitioner, largely spiritual health is treated the same way. There's a problem, let's fix it. I'm not feeling well, I'll get a massage. I'm not in good spirits, I'm going to go to yoga. I need this, I go to a spa, as examples. Not why did it happen in the first place. Now, I don't mind fixing things, as I said. My only concern about fixing things is I think it perpetuates a lack of agency on the part of the individual. I think it is actually enabling of bad health. It says, you can go and do all these things that are problems. Don't worry, come in, we're going to fix you. If I told you that a heroin addict came into me, strung out on heroin, I treated them and they were great and they went out to do heroin again, you'd probably say, why are you doing that? You're just enabling them to go continue to be a drug addict, and you'd be right. But our medical industry works very much the same way, and our mindset is very much the same way as people. We want to eat what we want to drink what we want to stay up as late as we want to exercise as much as we want to do everything we want, because if it gets to a point of being critical, there's a cure. If we have a symptom that's a problem, we can palliate it. If we do anything we can, and my biggest problem with that approach to health is, in so many ways, it perpetuates irresponsibility, takes away our agency, and we essentially are being made into victims, which is perhaps a little strong, but I'm willing to go with that. So, if I go back thousands of years as well to when there was pig bite, the kind of acupuncture I practiced was practiced very differently, and it's a way that conceptually makes sense to me. You'd have a community. You'd have an acupuncturist who was the doctor. It wasn't alternative doctoring, that's what you had. Everybody in the community came to the acupuncturist. They'd treat you. They would keep you healthy and they would prevent you from getting ill. And you continued to pay them, get this, so long as you were well. And if you ceased to be well, you ceased to pay them and they continued to treat you. The idea was that they kept you from getting ill. That was their job. You listened to them, that's what they did. And then, if you became ill, either they weren't doing their job in one brew, or how can you pay them if you can't work and you're not well? Now, this model, when I tell people this, sometimes it's a little crazy, but it makes sense because it introduces a different notion of health. Not health as absence from disease, not health as a cure, but health as living well and or thriving. And it was the responsibility of the doctor to keep you well, to keep you in yourself, and to make sure that you lived a good, healthy, and full life. Okay, and back then, quite frankly, it wasn't just physical, it was also mental and spiritual. So, where are we right now? Human beings. We're different than we were in 1900, but I'm going to ask a question, which is, are we happy? In the 1900s, most of the problems that people came to doctors for were physical problems. But right now, most of the problems that people come to doctors for, get this, are mental problems. Dis-ease. Antidepressants, according to CNN, are the single most prescribed drug treatment in the United States. There were 118 million prescriptions for antidepressants last year. 118 million prescriptions. They went on to conclude in the article on CNN that too many people take drugs when they really need to be making changes in their lives. And Dr. Kelly Posner of Columbia said that depression is the #1 major public health issue right now. Okay? We have 118 million prescriptions for antidepressants. The most, more than anything else, more than headaches, asthma, flu, anything. Single most prescribed is that. So when I'm saying we're a little bit behind in thinking about things, it's already happened. It's no longer just the physical. The #1 visit is mental now. That's where we stand. So, the next closest, by the way, high blood pressure. Okay? High blood pressure, I said we can cure external factors. High blood pressure is something that is self-curable in 90% of the cases. You eat differently, you exercise, you do things. So the next most likely thing you're going to be prescribed for is something that you might just think, hey, I can take a pill for, rather than taking agency, as a side note. All right, so for the next generation, if we can, as Kurzweil say, we can cure physical health, we're left with mental and spiritual health. Right? That's it. Okay, so I'm saying that we need to start thinking about health in a completely different paradigm. Not just absence of disease, not just cures, not just are we physically well? We need to begin thinking of this as thriving. So we have a few challenges. We're facing a medical system which promotes cure-it mentality. It does not encourage individual responsibility. We deal with mental health the same way. There's no different paradigm predominantly to deal with it in any other way. We don't necessarily investigate or put precedence on the causes. We don't necessarily know what they are, right? And no one mentions spirit anywhere. What is it? Is it God? Is it religion? Is it the Tao? Is it the Force? What is it? Okay, I have a view of spirit. It used to be that people would say, I'm in really good spirits, and you knew what it meant. It used to be that people would come and you'd say, oh, you look really good. I can connect with you. We'd make eye contact. In a community setting, there would be an interaction. And you're not interacting with the body. You may interact with the mind, but you're interacting with the person, with their spirit. There's been a lot of talk about community forming and a lot of talk about, sort of new technologies in this. There's a woman named Sherry Turkle, who I know a number of you may know of, who's an MIT professor. She wrote a book called Alone Together. And her conclusions, and this is my paraphrasing, was that teens right now, and she studied them for 15 years, are not happy, and that they are faced with technology, new forms of communication, which are creating more disconnection from each other and, in fact, more disconnection from themselves. That they turn externally to figure out their emotions rather than internally. That they often try and represent and reference emotions that they've not yet had because they're trying to capture something that they're unaware of. To me, that's that they're looking for their spirit. They're looking for their connection to themselves. They're looking for the connection to others. So, looking forward. I looked up in Wikipedia because I thought, what's the definition of health right now? And it starts out, health is a level of functional and or metabolic efficiency of a living being. In humans, it is the general condition of a person in mind, body, and spirit, usually meaning being free from illness, injury, and pain. That's the model. If we go back to the World Health Organization over 50 years ago, in 1948, it defined health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. It later expanded to include intellectual, environmental, and spiritual health. Okay? This is a remarkable statement to me, considering that it was originally created in 1948, and the World Health Organization is not saying it's the absence, it's saying thrive. So, here's my point. Health is not the absence of disease and symptoms. Health is not just physical. In fact, it's less and less physical. Health is not just physical and mental. It's less and less that as well. Health is about the person thriving. Thriving in our lives, that's health. Okay, bright eyes, enthusiasm, a full set of emotions, everything. Now I'm going to give you a couple examples from my work. I know I'm running out of time, Lauren. Let me go over a little bit if you would. Okay? So I had a patient who came in a little while ago, and I said, what are you here for? What would you like? And she said, I'd really want to be more relaxed. And out of my mouth came, why not totally relaxed? Why just more? Why do you want to be more something? If you want to be relaxed, why don't you want to be relaxed? And she said, is that possible? And I said, of course. She said, I'm not allowed. I said, why are you not allowed? She said, I have to do this and this and this. She said, fine, just make me physically healthy, I'll take care of the rest. And I'm thinking, oh my God. Okay? That's one example that just, it kind of blew me, that blew me away. That was just like, that was it. Another example is somebody who came in and said, what can I do? And they said, fix me. And I said, what's wrong? They said, you're the doctor, fix me. And I said, what are your problems? Fix me. And I'm thinking, and I said, I can't. No one can. There's no panacea. I'm not God. I'm not magic. I said, what I can do is I can support you so that you can fix yourself. Oh, no, I don't want to be here. And they walked out. Okay? This is the kind of thing that's happening out there. Okay? So my challenge to the next generation is, physically, more and more you're going to be taken care of. Mentally, more and more it's being addressed, but maybe not towards cause. Spiritually, the only indication that I have that I can show you that I know that a shift is taking place, and I know that we know it in ourselves, is the incredible rise of alternative medicine. There were more visits to alternative medicine practitioners in 2005 for the first year than there were to conventional doctors. People are looking for something, and they're not looking just to be cured, fixed, or taken off. We all know that that's it. I'll leave you with one thing, which is the man who founded the kind of acupuncture I do, J.R. Worsley, was very famous for a lot of things, but one of his, this is again paraphrasing, said, when the body is weak, the mind is not sound, and the spirit cannot be reached. When the mind is troubled, it neglects the body and ignores the spirit. And when the spirit cannot be reached, there's no drive to support the mind or the body. It's all connected. We're focused almost exclusively on one. I want the next generation to start realizing the shift has happened and to look at it in a completely different way. So, thank you very much.